I'm now taking the science that I've been explaining to you over the while and correlating it to real world issues that are likely to happen or already happening. And what I'm talking about today is what will be happening in emergency departments across the world, especially in highly vaccinated regions. Now, when I say that, that annoys some people, but it's because I am looking at the information that is relevant to what is going on. So, critically, if you want to understand the science, stick with me as we go through this. Remember to like, comment, and share if you can. We really do appreciate it. Before I start, just a reminder as to what's coming up about COVID's hidden time bomb, rapid arterial aging. There's a reason this is so important. And this preparation actually made me talk about this point. It's because of the science around this that we're going to see this surge in demand with regards to accident and emergencies. If you don't make the connection, it doesn't make sense until you or your loved one gets sick. This is important information. So please join me. Look in the description to find the link below. Now, what did I do? I took the information from A&E attendances and emergency admissions July 2025 to try and understand what the pattern is. And so they have been looking at data since a good period of time, comparing performance levels across a number of trusts, looking at total number of attendances in July, and they found there was an increase of 3.6% compared to July 2024, total number of attendances. So the first thing that you know is that it suggests that the population is sicker. Why? Some part of it is definitely COVID because COVID makes people sick. But I have learned never forget the elephant in the room. If you exclude that, you're missing a big piece of the picture. So when we look again in July of 2025, for type 1 A&E departments, these are the major accident and emergency departments that are consultant led. This was 3.1% higher compared to July of 2024. So this is where the sickest people go. And you can see year on year, this seems to be increasing. Similarly, the type 3 departments, which are more like your urgent care centers, this had a 4.5% higher rate compared to July of 2024. Year on year, this is increasing and it's putting huge pressure on the system. And one of the things I point out is that if you understand the science and you know what is happening and you can see the patterns of illness, this is not going to stop. This is one of the mistakes people make. They somehow imagine that this will go away. No, it's not. When you understand the science, and as I said, this is why you join me for this presentation, because it's linked to all of the big conditions: heart disease, stroke disease, dementia, kidney disease. Critical to understand why this is happening. Now, if you thought that this was significant, so when you see here in terms of the emergency admissions, 559 thousand emergency admissions in July of 2025. Again, an increase of 1.3%. And you can see this year on year breakdown of increase in numbers. More and more people are getting sicker and sicker. And you have to remember, this is on a background of significant numbers dying in the early part of the pandemic. So, what you would have expected is reduced demand on the health system. Instead, you're getting the opposite: increased demand. What is going on? Now, as I said, when you understand the inflammatory process and the fact that COVID and ongoing circulation of COVID causes vascular, that's blood vessel involvement linked to rapid arterial aging and all the diseases around it, when you understand that, you realize why this is increasing year on year. So what I did is I did an exercise. And so you have to follow along with me as to what it means. Because as I was looking at those numbers, I had a thought. How does this compare to, say, 2018? Because at that time, you still had a lot of sick people. The system was already under pressure. But where is it in comparison? Because we keep on talking about the pandemic. Is it about the same, a little lower, a little bit higher? What is going on? So I did that exercise. And here is what it showed. This is very important. So let's start off. When they look at all A&E admissions, 2025 compared to 2018, you can see a 10.7% increase, just comparatively. All emergency admissions were up 5%. When we look at the type 1 admission rate, this is the most serious illnesses, comparatively, it's actually a little less. Now, this may be partly due to reduction in services across the country, and maybe they don't have as much capacity. It may be due to the fact that they're diverting more patients overall into type 2 and type 3 services. This bit here is important. Now, if you don't know, the 4-hour performance is making reference, and so this is in July 2018, and this is July 2025. It's talking about how many people have been seen and discharged from an emergency department within 4 hours. And this was a target that had been brought in so that you wouldn't have people waiting too long in the hospital. So it's an important target, very difficult to try and achieve. And you can see even in 2018, they were struggling at 89.3%, when I think they needed to be above 95%. So they were still struggling. But as you can see here, is that it's now down to 76.4%. In type 1 units, it went from 83.5 to 63.1%. Now, this is a very important red flag, because you either should have admitted the patient or discharged the patient within 4 hours. So this is a significant drop off between 2018, when there was already pressure, and 2025. If they were over 4 hours, what we call trolley waits, where they have been a decision to admit the person, but they're waiting for a bed, in July 2018, it was 41,000, compared to 2025, 115,000, a 178% increase. These are huge numbers. And this is why I said it was an interesting exercise to take the comparison of 2018 to 2025, because what it is indicating is that the population is very sick. COVID is certainly a part of it, and it is still circulating. Believe me, just recently seen somebody who had COVID complications. They had absolutely no symptoms before they had the complication. They only were found to be positive because of a specific symptom that made them tested. What it means is that so many people are likely to have COVID and almost have very mild, sometimes just a headache, sometimes just fatigue. That's all they get. But a week, 2 weeks down the line, they can have serious health complications. Here is the biggie. When they looked at the comparison here, in terms of greater than 12 hours decision to admit, it was 147 in 2018 compared to 35,000, almost 35,500 in 2025, an increase of 24,000%. This indicates a system under pressure. And we are talking about July. Remember, this is July. This is the middle of summer. 35,000 people had to wait greater than 12 hours. I bet you this is happening all across the world. Now, there are some countries that have lots of capacity in their system, but I suspect that this pressure is only going to get worse. And why is that? It's because of this hidden time bomb. It's starting to manifest itself. This is just the warm up, a 24,000% increase. And this trajectory is only going to get higher. I recently did one on morbidity, people who are sick of work. It's the highest level it has ever been in the USA. And so if these people are this sick, they are going to be putting pressure on hospital systems. We need to understand what is going on. We need to figure out how to try and mitigate the damage that is occurring. At the moment, all you're getting is silence. What I'm saying is that in the long run, your health is your responsibility. If nobody is doing anything for you, you need to understand and figure this out for yourself. Because at the moment, the silence is not in your interest, and it's likely to only cause problems in the long run. Remember, as we close out, we want you to like, subscribe, and comment. Comments really help the algorithm because a lot of people don't know this information and they will never see it because this kind of content is largely suppressed. Remember again, join me for this event. It's coming up tomorrow. Really critical for you to get an understanding of the science of what is happening. Have a great evening.